So formally, I welcome and thank all of you, including our brothers and sisters from the region, for your presence here today for this regional workshop to relaunch the HIV case-based surveillance. I wish to say to you that in this country of St. Vincent and the Grenadines, our blessed homeland, the prevention, surveillance, and control of HIV are paramount priorities to us. Additionally, the epidemic attributable to HIV remains a significant public health issue in the country, one which we cannot effectively combat on our own. As such, we are indeed grateful that we are among the other OECS countries, our sister countries. We are indeed grateful that we are among these countries that is benefiting from the Global Fund multi-country grant, which is intended to assist us and the region in our fight against HIV, AIDS, and TB. As I stressed, this is of significant importance to us. We are even more grateful that our capacity, or the capacity of the ministry and our health officials, will significantly be strengthened through this HIV TB elimination project. As you're all aware, as officials, health officials, and professionals in this room, one of the goals of the OECS HIV TB elimination project is to build the capacity of health officials and ministries, health ministries, and also the HIV program to ensure a sustainable disease surveillance system, M&E, and strategic information analysis and use. Now, all this is being done through the implementation of the following. It will ensure a functional HIV electronic case-based surveillance system. It will assist in the collection of timely, accurate, and highly quality data from testing site and treatment facility. As I stressed before, it will also assist in capacity building for staff to use the system to generate data to describe disease impact and for planning, monitoring, and evaluation. I believe the HIV case-based surveillance will be a very useful approach to measure our achievements of the UNAIDS 1990 target, which is aimed at ending AIDS by 2020 and TB by 2030. At the same time, it will provide a platform for tailoring and evaluating HIV programs. We are indeed very happy that in St. Vincent and the Grenadines, the Ministry of Health, Wellness and Environment is playing a very significant role in leading this initiative, and that the HIV electronic case-based surveillance is being piloted here in St. Vincent and the Grenadines. We're indeed happy for that. And I wish to make clear to you some of what we have been doing thus far. In last year, well, I say last year, but this is just January, but in November of 2017, our consultant, Mrs. Mildred Aisha Fakoya, Health Information System Software Developer, she began in a very assiduous and workman manner holding discussions about HIV electronic case-based surveillance with the staff of the HIV unit and that of the Ministry of Health. Our own IT unit, and I wish to say to you that some of these sessions were very long and detailed, but very useful. And I also wish to commend our own IT unit for the role that they have played and the way in which they were able to collaborate with the consultant on the project. You might also be aware that Ms. Fakoya designed and implemented the training and supporting supervision to all levels of the health system. She also provided training and monitoring for health IT staff to facilitate HIV case-based surveillance, roll out in selected pilots, and for further implementation countrywide. So she has done and she will continue to perform a very important role in this manner. That was November. But in December of 2017, the official HIV electronic case-based surveillance training actually began. That was in December of 2017. 20 persons were trained in the CBS system, persons from the public, private sector, and also persons belonging to the NGO community. On the 18th of December, a mock clinic, MOCK, was held to assess the competencies of the persons who were trained, after which certificates were awarded for successful completion. And there were some outstanding personnel who were awarded these certificates, and especially so, the certificates would have recognized exceptional performance. And I'm saying that, and some of them are sitting in this room, who would have done exceptionally well. Where are we now? We are now at the stage where the HIV electronic case-based surveillance is being piloted in 5 health facilities, 3 of which are public, 1 the private sector, and 1 an NGO. And this began on January 8th of this year. So you can appreciate the reason why we're very happy to have had the opportunity to pilot this program and this process. We wish to express our heartfelt thanks to the OECS Commission for selecting St. Vincent and the Grenadines to pilot this system. And we are by no means in any way sorry that this was the case, although we understand and we wished Dominica very well, because we do understand that this should have been something that should have been rolled out there. But I'm making the point that we are indeed grateful that this is the case. And I am also positive that the experience, and I know that this is part of the entire plan or the grand scheme of things, the experience that played itself out from this pilot and implementation phase will help to inform the process going forward. So we have a lot to be thankful for. I once more wish to acknowledge the hard work of Ms. Fakoya. She showed tremendous dedication to what she was doing. She brought extreme professionalism and determination to her work, and the participants can attest to that. And we wish to thank her for the role that she has played. To our director, Sister Ferosa Roach, and her team, her staff, again, I personally wish to express my personal thanks. She has done exceedingly well, and I think I'm pleased with the work that was achieved to date. I mentioned, but in a very brief way, our own IT staff. And it is a small unit, but again, I wish to thank them for being a part of the process and for their dedication to it. And I urge us to continue in this manner. There was a participation from several private labs here in St. Vincent. In terms of piloting this process, not only the Ministry of Health and our HIV unit and our IT unit played a significant role, but I'm also saying that there were other entities such as private labs that played a part. I wish to thank you all, and I wish to thank all of us for our commitment to this process. I really look forward and urge us to make full use of the system. I note that this is a relaunch, and a relaunch means that something was there before. And in this instance, we have achieved much. We have expended tremendous energies, and this time I urge us to utilize the system and make it work. May God bless us all, and I thank you very much.